Hello, and welcome back to Student Nurses Success. We are going to cover neoplastic white blood cell disorders, leukemias and lymphomas, in this two-part video. Part one is going to cover some basics and general information about blood cell cancers. Your completed map will look like this when we're finished. Remember, the link to the maps can be found in the comments section. Now, I know you're a busy nursing student, so no need to waste time. Let's get started with our blank map. And the first thing we want to do is start with a few words about what is the difference between leukemia and lymphoma. Both are considered white blood cell cancers, but leukemias are proliferation or dysfunction of the bad or white blood cells that start in the bone marrow, and these cells then circulate throughout the bloodstream. So, leukemias are actually circulating cancer tumors. They're circulating through the bloodstream. Now, lymphomas are an overproduction of non-functioning or bad lymphocytes. And these lymphocytes are bad. They do not do good work. They do not work like they're supposed to. A lot of times, lymphomas, the collection of these bad cells tends to locate and collect in the lymph nodes and the lymph tissues. Although lymphocytes are a white blood cell, when they collect in these tissues, they tend to clump and make a mass and cause inflammation of the lymph tissue. So you can actually palpate these lymph nodes, and often they're painless when you palpate them. Now let's talk about general etiologies or causes of leukemias and lymphomas. General causes include viruses, especially Epstein-Barr virus and the HIV virus, radiation exposure, genetic disorders, such as Down syndrome, we know increases the risk of leukemia, chemical exposures like maybe benzene, and just general immune suppression. If you suppress your immune system, then you reduce your body's ability to keep those mutated cells in check. And what happens is then they tend to proliferate and grow. Now, the neoplastic white blood cell disorders fall into two main categories: the myeloid and the lymphoid types. Myeloid cells include red blood cells, platelets, monocytes, and granulocytes. The myeloid leukemias we'll talk about in part two include CML and AML. Now, CML is chronic myeloid leukemia, and AML is acute myeloid leukemia. The lymphoid category includes the overproduction of lymphoid cells. Most often, B cells tend to be the one that we see most commonly, but the others can also overproliferate. These white blood cell neoplastic disorders include CLL, ALL, multiple myeloma, and a lot of times this is actually called plasma cell myeloma, Hodgkin's, and non-Hodgkin's. Now, CLL is chronic lymphocytic leukemia, and ALL is acute lymphocytic leukemia. We're going to cover these in more detail in our second uh, part two recording. Now let's move up to the general manifestations of leukemias and lymphomas. And the general manifestations include what we call pancytopenia. Pancytopenia is the underproduction of red blood cells, which causes anemia, the overproduction of bad white blood cells, which actually do not help and they lead to infections, and a decrease in platelet production, which leads to bruising or bleeding. The pan means the three things, so it's the three components: the red blood cells or the anemia, the bad white blood cells leading to infection, and the decrease in platelets leading to bruising. So, because of the pancytopenia, you're going to see fatigue and malaise. These are related to the anemia and decreased red blood cells. You're going to see infections and fever, and this is related to the poor quality of the white blood cells that are being produced and overproduced. You'll see bleeding, bruising, and even petechiae, and these are related to the decreased platelets. Other manifestations are going to include bone pain, night sweats, weight loss, and enlarged painless lymph nodes. Now, these general manifestations you're probably going to see in most all of these 7 types of white blood cell disorders that we're going to cover. Next, let's talk about diagnostic or lab tests. These are going to be altered in leukemia and lymphomas. So the first thing you're going to probably see is the CBC with differential is going to be off. It's not going to be normal. And remember, your CBC includes your hemoglobin, hematocrit, which are going to probably be decreased, your neutrophils and white blood cells, which are going to not be in appropriate proportions, and your platelets, which are probably going to be decreased. What happens with these is that these overproduction of these neoplastic cancer cells actually crowd out your good red blood cells and your good platelets. So a lot of times this is the first test that a provider will run is a CBC with differential. Now this won't diagnose cancer. This is really kind of just identifies a concern. What you really need is a bone marrow biopsy. The bone marrow biopsy is really what's going to be definitive and be diagnostic. You go to the bone marrow and you will identify those cells. And sometimes they're called blast cells, that they're not made normally. Remember, cancer cells are bizarre and they don't function well. The other thing that you actually might see, and I'm going to put this down here, is imaging studies. Things like x-rays, or maybe MRIs. What these might actually is, these could identify maybe metastasis or tumors or enlarged lymph nodes where maybe B lymphocytes have kind of gathered and collected there. But again, that won't be diagnostic either. The bone marrow biopsy is really your diagnostic test. The third lab test that you're probably going to see drawn is what's called an ANC count. It's an absolute neutrophil count. Now, ANCs are actually a reflection of risk of infection. Often we draw an ANC count when patients are undergoing chemotherapy or some type of treatment. The treatment kills the bad cancerous cells, but it also kills some of our good cells too. And sometimes we can actually lower our good white blood cells to the point where we open ourselves up for a risk of infection. If your ANC is less than 500, you are high risk for infection. Normal ANC counts are usually greater than 2,500. And so if you're anywhere less than 2,500, the closer you get to zero, the more at risk you are for getting an infection. Now, ANC can be calculated, and here we actually have the formula for it. You take your white cells times the sum of your polys, segs, and bands, and then you divide all of that by 100. Now, let's talk about general treatments. Chemo is one, radiation is another to shrink. Sometimes that can kind of shrink some of the tissue and the maybe where the collection of cells is. And also a bone marrow transplant. Now, a bone marrow or stem cell transplant falls into two categories. You can have what we call an allogenic transplant or an autologous transplant. An autologous transplant is from yourself. So we would store your own bone marrow, maybe give you a treatment that we know will damage your bone marrow, and then after the treatment we can reinfuse your own bone marrow. An allogenic is from a donor. And so sometimes if your stem cells are not correct and they are the problem, we can actually graft in someone else's stem cells and take over and get rid of the cancer that way. And here you go. This is your finished map. So make sure you watch Neoplastic Disorders Part 2 for more information about each type of leukemia and lymphoma. And remember to subscribe to our YouTube channel to stay up to date on any new videos to help you succeed in nursing school.